one.
We're going
Waiting for
live.
TikTok and...
All right, hello everybody. Dr. Alex Earl here, and it's Hump Day with Dr. Alex Earl. And of course, the time we got to spend with you guys, we're going to talk about plastic surgery topics and answer all your questions, okay? And just as a quick reminder for those of you who might be new, I am a double board certified plastic surgeon here in Miami, and I have a private practice called Pure Plastic Surgery, okay? So I am happy to answer all your questions regarding plastic surgery, or myself for that matter, from head to toe, okay? Plastic surgery from head to toe, and we can talk about anything from like what to do before surgery, what the operations entail, post-op, recovery, etc. Okay? But before we delve into your questions today's going to be mostly, we're going to kick it old school here mostly today. So that means we're going to do mostly a question and answer period. I think people really love that. You can get your yearning, burning questions answered here today. But before we get into that, I want to talk to you guys once again about the Pure Total Definer package, okay? So I started this towards the second half of last year, 2023. It's been a great addition to what we do here at Pure. And we call it the Pure Total Definer package because for a few reasons. One is because we're totally redefining your body, going for that more athletic look, okay? And it's the total package because it includes just about everything and anything that you might need in order to, really change that body to that more athletic look, okay? So what is it? Right? And what does it include, right? Well, what's the goal? First of all, the goal of the Total Definer package is to bring out typically what I like to call an enhanced natural athletic look, and it can be both for men and women. This is really important. So men can have this Total Definer package as well, because we're talking about bringing out the musculature that's kind of hiding underneath there, okay? So in men, that can mean the six packs, it can be the chest, the deltoids, which are the shoulder muscles here, the biceps, of course. And then for women, also the abdomen, but typically not the six pack, that more that athletic feminine look. And we can then pop out the hips and the buttock as well. Okay. So what does the Total Definer package include? So the main thing that we're doing is a total body HD lipo. Okay. So HD stands for high definition. So total body HD lipo, we're doing HD high definition lipo. It means that we're doing lipo in a way that brings out those underlying muscles, okay? And what I mean by total bodies is that it can include any area that you have a concern with, okay? So it can be, of course, the abdomen, it can be the flanks and the waist, it can be the trunk, that's kind of the baseline, right? But it will also can include the axillary areas, the arms, okay, the chin, if you want to take care of that as well. It includes the entire back, and in men, it would include the chest also, okay? So really it includes all those areas, and that's already all baked into the package there. So we're not going to be doing like, okay, you got to add this on, and you got to add that on. No, it's one total package. It includes all this stuff for one set price, one fixed price, okay? All right, so what else does it include? Well, the best results for HD lipo come now with a new device that we've been using also in the second half of last year called the Vaser, okay? And the Vaser is a device that uses ultrasound energy, okay, to what we call emulsify or release the fat. So the ultrasound energy creates these vibrations, it releases the fat from the surrounding tissues, okay? It makes it easier to remove the fat, and you can do it in a way where there's less bleeding and less inflammation, and better skin retraction. So we can remove more fat with less bleeding, less inflammation, and better skin retraction. So it's a great device, and it's part of the package here as well. Everything that I've written down here is already included in the package, okay? So you're also going to be getting your cell saver. That's the device that we use to basically run the fluid that we remove, the liposuction. We separate that fluid out from the fat. The fat is what we preserve then for transfer. That fluid we then pass through the cell saver, and the cell saver basically grabs the red blood cells, it filters them out, and then we can give those back to you as an auto transfusion, which is great because that means that there's less blood loss for the procedure, okay? Because we're giving you some of that blood back to you, okay? And it's of course, it's your own blood. It passes through the machine, and we give it back to you all filtered out. So that aids greatly in recovery because overall less blood loss. That means that you're feeling better, stronger, sooner. Okay, so it definitely helps for recovery and decreases the chances of potentially needing a blood transfusion after surgery. Okay, but not only do we want to define the muscles, we want to help the skin along as well. Now, this is not going to be for someone that has, severe loose skin. All right, if you have severe loose skin, then your first step is your tummy tuck. Like I always say, do your tummy tuck first. All right, let me say that again. Do your tummy tuck first. Okay, but you can do your tummy tuck, and once we've tightened up that skin, we've removed all the excess skin, we've done the muscle repair underneath there, then you can come back and do your pure total definer package. Okay, but sometimes there's mild to moderate skin laxity, and we want to help that along without having to do a tummy tuck. So included is also these modalities that are going to help tighten up the skin. So one is your body. We already talked about the Vaser. That's going to help. We can also add Body Tight as well. So the Body Tight, I think, works really, really well for the arms and the inner thighs. Okay, the Vaser works really well for the abdomen and the back. Body Tight works really well for arms and inner thighs, so we can add that. Okay, and also, more superficially, we can add the Morpheus. Okay, what is the Morpheus? Well, that is radiofrequency microneedling. So microneedling with the power of radio frequency, okay? And that helps the skin retract at a more superficial level because those microneedles go from the top. And this is great to also add to the abdominal area, especially around the belly button, okay? You guys have probably seen sometimes after liposuction when there's loose skin around the belly button, you can have a little bit of that donut shape over the belly button. We call it umbilical hooding, where the skin is loose there. And so this helps try to prevent that when you add the Morpheus to that as well. Okay, so all this is being included. Of course, fat transfer. And I didn't write here BBL because I'm not talking about just fat transfer to the hips and the buttock, although this is of course what's most common for women. So for women, they love the HD, liposuction. They love, that feminine abdomen where it's not the six pack, but it's that feminine abdomen where we have like the muscles coming up and down and the obliques as well. And they want to add a little bit more to the hips and the buttock. And so that's for women, that's where most of the fat transfer occurs. But for men, it's a little bit different, right? Men want to bulk up certain muscle groups, all right? So they don't necessarily, of course, want hips. They may want a little bit more in the buttock, but they also want to bulk up other areas, such as your biceps, right? So we can give you a bit more volume to the biceps. We can give more volume to the tricep area, to the deltoid, which is this shoulder muscle here. We can give a bit more volume to the pec muscles or the chest muscles as well. All right, and sometimes you want to have kind of that wider neck. We can put a little bit more fat into what's called the trapezius muscle, which is that kind of V-shaped muscle coming off the neck as well. And if you want to have a little bit of that wider back, we can put a little bit fat to that latissimus muscle, which is this muscle that comes off the side through here as well. So we can do all that to create that strong male V shape. And we can do that with the aid of fat transfer and the use of the ultrasound imaging and what's called U-graft. Okay, so basically grafting fat into muscles with the use of the ultrasound. Remember, of course, we're also going to be using the ultrasound imaging for any fat transfer over the gluteal region as we normally do. Okay, so that's all included. And that's all kind of part of the surgery. One of the things I didn't write on here, but sometimes we can include as well, if you have just a little bit of the excess, that excess loose skin in that lower belly, a little bit more than what just say maybe the Body Type or the Morpheus can handle, sometimes we can include like a little mini tuck also. And that's not going to change the price, okay? It's going to be part of the package deal, okay? But that's all the surgical stuff. But guess what? We're not just talking about surgical stuff included in here. We also include your POP recovery system. So these are the folks that are going to help you out before, during, and after surgery in terms of your nutrition, in terms of your post-op care, how to get your massages, your fajas, and also emotionally, okay? They have several counselors that are going to help you through that physical and emotional roller coaster that everyone goes through after surgery, which I think is super, super important. So that's going to be included in there. We include the cosmetic shores we do for all our surgeries, meaning that if for whatever reason you have to go to the ER or anything like that, a lot of your primary insurances are not going to cover something that's due to a cosmetic surgery. So that's why we have the cosmetic shore. It's a secondary type of insurance that will help to aid cover any expenses if for whatever reason you need to go to the ER after surgery, and we include that there for you, okay? We're also included in the hotel, so AC luxury hotel stay is included in the package, okay? And your post-op care. So we include nursing care for you as well, and we do that through our partners at Med Miami, okay? And they can help you and aid you in the immediate post-operative period while you're here in Miami, okay? Now there's one caveat that I do want to say about this. You still need to bring a caregiver, okay? In other words, you still need to bring someone with you, all right? Because they're not going to be there 24/7 for the first 7 days, okay? They're going to be there for about maybe 12 hours a day or 8 hours a day, but they're not going to be there 24/7, okay? So you still need a caregiver because you still need someone to be with you pretty much, at all times, okay? All right, but the Med Miami nursing care is included also. All right, so the entire thing, we pretty much covered we've taken care of everything that you need. All right, the only thing that could be what I say optional, and this would be in addition to the package, is if you need transportation, which we can still organize and provide for you. But if you need transportation, for example, from the airport to the hotel, from the hotel to the clinic, back and forth, we can get that organized for you, but it would be an optional kind of additional cost. Okay? All right. So, quick reminder, quick refresher here. Let me just answer this question, which I'm sure is going to come up. Like, who's a candidate for this procedure, right? I'm sure that's like question number 1 or 2 on there.
It's 3 times now.
Yes, it is true that not everyone is a candidate for this procedure because you have to be in a little bit of that lower BMI to really be a good candidate for this procedure. And by that I mean you have to be in a BMI somewhere between 20 and 25 or so, okay? Typically if you're in a higher BMI range, then you're not, the HT lipo doesn't really apply. And so we need candidates going to be a little bit in that lower BMI range. You have to be, of course, someone who is very health conscious, who has good nutrition and exercise habits, because after doing all this, you want to be able to maintain that for the long run, okay? And that means hitting the gym afterwards to maintain these results. It means having appropriate diet and nutrition afterwards. And that's where the POP recovery systems is going to come in and help, because they're going to guide you as to what to eat, how to take care of yourself, exercise programs and things like that after surgery, which of course once you get that, you'll have all the information you need to then eventually take it on yourself. Okay? All right. Questions?
Okay, let's wrap like 3 zillion questions here. How can I get a consultation? That was the first one.
First one. So yeah, so I'm like talking to you about all this package. You're like, Doc, but how do I get this? All right. So the first thing is you're going to go to our website, which is www.pureplasticsurgery.com. Okay. And there you're going to see a button that says virtual consult or virtual consultation. All right. And you hit that button, you're going to come up with a questionnaire. You're going to answer all the questions. And you're going to send us 3 photos. Okay. One of the options there is going to tell you like what procedure are you interested in. Okay, one of the options there is going to be total definer package, and you can click on that. And then that's all going to come to us. One of our patient care coordinators will receive your information, and then they're going to reach out to you, okay, and they're going to give you a bunch of information, answer your questions, go over pricing, scheduling, etc., etc.
What's the ideal BMI to have going into a mommy makeover?
So for a body makeover, at least for me, I go up to a BMI of 30. Okay, so 30 is the max. There's typically not a low point on the range. On the low side of the range, it could be anything that's healthy, of course. But anywhere from 19 to 30 is fine. And so if you're within that range, you're okay.
Okay, do you blend fat from hips to thighs if necessary during a BBL?
Definitely. So you definitely want to do that because one of the ways that we achieve our signature Earl curve, right? Our signature kind of upside down heart and enhanced natural shapes is by blending everything in and making sure that all the transitions are nice and smooth. Okay. So in order to do that, sometimes we have to kind of feather it in, blend it in, to try to create that smooth transition. Now, what I mean by that though, it is truly at those transition points. Okay. Don't think that I'm going to be basically fat grafting the entire thigh, right? That's very, very, that's not something that anyone does. It's very, very difficult to kind of try to fat graft the entire thigh. But what you want to do is, make sure that you're tailoring the surgery to that patient's unique foundation. And yes, feathering everything in, smoothing everything in, so all the transitions move nice and smooth.
Okay, can a breast augmentation be done with fat transfer?
So technically, can it be done? Yes, but there's lots of buts. Okay, you can transfer a certain amount of fat to the breast, and that of course will give it more volume. But you are fairly limited as to how much fat you can transfer to a breast. It's much less than to the buttock or the hip. All right, the breast itself has its blood supply is not as robust as the buttock and the hip area, and therefore you can only transfer certain amounts before you get into problems with like fat necrosis, basically fat that didn't survive and becomes a scar ball, and so it's called fat necrosis. Okay, so typically most breasts won't take much more than say maybe 200 to 250 cc's or so. So that can give you, of course, some more volume, but it's not going to give you a huge change, right? The other thing that fat transfer to the breast does not do is that it doesn't really alter the shape of the breast. Okay, so you're going to have a breast that's very similarly shaped, just with a little bit more volume. Okay, which for most patients are not going to be truly, happy with that. So that's why I think I like to use breast implants. I think breast implants are a lot more powerful in the sense you can really bring in a lot more volume and you can change the shape of the breast to something that's more aesthetically pleasing. And of course, it's not much easier to fill that upper pole of the breast as well with an implant. So my go-to for most breasts would be a breast augmentation with silicone implants.
Doc, do you do tummy tuck scar revisions?
Yeah, so we definitely do tummy tuck scar revisions. Of course, every patient's a little bit different, so I hope to see exactly what it is we're talking about. But I would encourage you to send in, fill in that consultation form. So you can fill in your information, send in the photos, and I can take a look at the scar, what it looks like, and provide the best recommendation for you. But in the short answer is yes, we can revise the tummy tuck, we can revise the long scar, we can revise the belly button as well.
Okay, how come that you can do massages but aren't supposed to sit or put pressure on the glutes?
Right, because you're not getting massages in the gluteal region, right? So it's all about where these massages are happening, okay? So the massages are going to be for the trunk area mostly, or wherever you have the lipo in the arms, trunk, chin, but they're not going to be in the buttock and hip area, okay? And if your post-lipo lymphatic massage therapist has experience with dealing in patients that have BBLs, they're not going to lay you on your back. Like flat on your back, okay? So most of these massages are done kind of, in a position where you're kind of kneeling up, and they kind of massage you as you're kneeling up there. So I think if the concern is that you go to the massage and you're going to be laying on your buttock, most of these experienced massage therapists won't have you laying on your buttock for that when they do the front part of the massage.
Okay, how long should I wait for a boob job until after having kids?
So for the breast surgery, of course, it's important for it to be after you had kids, but also very important to do it after you stop breastfeeding. And that's really the key there, because you have to do it 6 months after you stop breastfeeding. Okay, so if you had your child, but you've been breastfeeding for 6 months, well, then you gotta stop the breastfeeding and wait another 6 months. Okay, so that's the key. You want to wait at least 6 months from when you stop breastfeeding.
Good. I have more questions.
All right, let's do this. Rock and roll.
Can you do arm lipo and boob lift at the same daytime surgery procedure moment?
Yes. So the answer for that is yes. Okay. Now, here in Florida, we are limited as to how much fat we can remove at the time of a procedure such as a breast lift, and that is 1,000 cc's of fat removal via liposuction. Now, most patients do not have more than 1,000 cc's in their arms, so that is one of the areas that we can add on to a breast lift. Okay, areas that we can add on are like the arms or the thigh or the chin. These are areas that have no more than 1,000 cc's of fat, even for most patients, okay, in the BMI of 30 or below. Now, what we typically don't do is a full lipo 360, okay, unless it's one of our thinner patients, all right? But if your BMI is 30, you're gonna have a lot more than 1,000 cc's of fat in your full lipo 360 kind of trunk area, okay? And therefore, then that becomes compromised, right? We do the breast and we can only remove 1,000 cc's. It's not going to be a big difference for you, okay? So I highly recommend then, in that case, doing it in 2 separate procedures. You can do your breast lift and then come back 3 months later and do your lipo 360, all right? But if it's just the arms, then yes, you can combine a breast lift with arm lipo.
Can AVLE be done the same day as lipo 360?
Yes. If it's lipo 360, definitely, 100% of the time, you can do AVLE at the same time. Where it becomes a little bit more tricky is if you're doing fat transfer, right? If you're doing a BBL. So if you're doing a BBL and AVLE, that I take on a case-by-case basis. If you have just some isolated, very well-defined cellulite dimples, then a lot of times you can do it at the same time, okay? But if you have, moderate to severe cellulite dimples, and they're like, multiple dimples throughout the buttock, then it's best to actually space it out. And you can do your BBL, allow everything to heal, and then after 3 months, come back for your AVLE treatments.
YouTube's waking up and
all right, wakey guys, how y'all doing?
Well, here's a question. How long before BBL should we avoid glute-focused exercise like weightlifting?
Yeah, so the good news is you don't really have to avoid that before the BBL. You only have to avoid it during the recovery period. So up until surgery, you can do your squats, you can do whatever glute exercises you like to do, and then yes, okay, you come in for surgery, you're gonna have to stop. There's no heavy lifting, there's no strenuous activity for at least 6 weeks. But then after 6 weeks, you can then start resuming. You can resume those exercises once again.
Do you use permanently or absorbable sutures in tummy tuck? And can a muscle repair be redone?
Right. So I use absorbable sutures for my tummy tuck. Okay, and the one that I use for the muscle repair is also a type of absorbable suture. However, it's a suture that eventually gets absorbed, but it actually takes several months, up to 6 months, for your body to fully resorb it, which is great because by that time your body's healed in its new position and no longer needs the stitch there. Okay, so it's like a long-term absorbable suture. And to answer the second question, can a muscle repair be redone? If it needs to be redone, certainly. So if it's not tight enough, it needs to be retightened, or maybe it failed the first time, it can be redone.
Up until when do we have to stop taking semaglutide for surgery?
Great question, because these are relatively new medications. I know they've been around most of last year. They became really, really famous. And so, there's a lot of questions around this. I mean, overall, just to take it back a sec, I think semaglutide, Mounjaro, all these weight loss medications are complete game changers. I mean, this is the real deal. Like, there's a way to lose significant amounts of weight simply with an injection. You no longer need to undergo bariatric surgery and go like a gastric bypass or a gastric sleeve. That's going to be the case maybe for some patients that are resistant to these medications, but for the overwhelming majority of people, you're gonna be able to lose that weight, lose it fast with these medications, and that's why we have our own kind of weight loss clinic here as well with semaglutide. So if you're interested in that, that's part of what we offer here as well. Okay, but how long do you have to stop it? You got to stop it 30 days before surgery. Okay, why is that? Because one of the ways that semaglutide and Mounjaro and these medications work is that they slow the gastric emptying, meaning that your stomach empties much more slowly, which is why you feel full all the time and you eat less, okay? But in terms of anesthesia, we want an empty stomach. You want to be on an empty stomach for anesthesia. And so the typical 8 hours that we usually give patients, if you haven't stopped it, it might not be enough and it can lead to problems. So we have everyone stop it at least 30 days before surgery.
Doc, for Adderley on Lipo 360, how long do I need to stay in Florida? Have a dedicated staff for recovery?
So you need to stay, you're going to be here in total about 7 days, all right? Because you have your pre-op day, you have surgery day, and you have to be here a minimum of 5 days post-op, okay? So that ends up being about a week, all right? And then in terms of, do you need, you definitely should, bring a caregiver. Someone's going to be with you, okay? But if you need, nursing care, we can provide that to you through our partners at Med Miami. So we can organize all these things for you. We want to make it as easy for all of you as possible. We want to make it what I like to call a frictionless experience, meaning you give us a call, you let us know what you need, and we take care of it for you, okay? Some patients want everything. They want the hotel, the post-op care, the whole shebang, and we can do that for you. Some patients are like, no, I want this, I want that, and so whatever it is, we'll take care of it.
Those breast lifts make it look smaller?
So not necessarily, right? You can do a breast lift and just remove the excess skin and preserve the breast volume. But here's the catch, because some people get a little tricked out with this. If you have this kind of long, kind of droopy breast, right, and you buy a bra, well, that bra is doing a lot of work. It has to basically hold up the entire breast. And so therefore your bra size may be, let's say for example, your bra size is a D. And then you come in for your breast lift, right? And I do a breast lift, I remove only the excess skin, I remove no excess volume, but now the breast is sitting up here and the bra only has to hold essentially 50% or half of the breast because the rest of the breast is already sitting up here looking pretty. All right, and therefore you may go down in the cup size of the bra from say like a D to a C because the bra is doing a lot less work, but it's not that you lost volumes and now the volume is being redistributed into the areas where you do want it, which is the upper pole of the breast.
Okay. Boom, 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 boom. Could you please come to California?
I would love to come to California. Unfortunately, I don't have a clinic out there, and my medical license is here in Florida. I have a medical license in New York as well, but not in California just yet. So in the meantime, come to us. We get patients from all over the U.S. We get patients from California all the time, Texas, and when I say all over U.S., I mean that it also includes even Hawaii. And we get patients from all over the world. We've had, I think our furthest, Australia is definitely the furthest, and probably second furthest is Ghana. And then of course we get a lot of patients from the UK as well. So patients from all over the world coming to us.
How do you prevent fibrosis or the ripple effect on the stomach after a BBL?
Great question. Okay, so there's many factors that come into fibrosis and or the ripple effects, which can be, the ripple can be either due to fibrosis or other things. Okay, so that's another thing I want to point out. But let's stick to fibrosis. Okay, so in terms of fibrosis, the post-op care is just as important as the surgery itself. Okay, yes, the surgeon has to do certain things. They can't make the flap, or what we call, like the skin, you can't make it too thin. Okay, I know a lot of patients, they come in and they're like, I want to be snatched, take away all the fat. Okay, sure, but you can't take away all the fat. Okay, you got to leave at least a good centimeter of fat underneath the skin to then minimize the risk of fibrosis. The thinner that you leave the skin, the higher the chance of fibrosis. Okay? So that part is very important. But then the next part that becomes important is the post-op care. And that's mainly your massages. So I do recommend post-lipolymphatic massage, a minimum of 20. Some patients may require more. All right. And sometimes you may require other modalities such as wood therapy or cavitation, radiofrequency or ultrasound afterwards as well. Okay. But all these things are incredibly important. And then of course your compression. You have to wear adequate compression with your foams underneath, okay, to really get everything to kind of, retract back as smoothly as possible. Now, talking about the rippling, sometimes the rippling is due to fibrosis, okay, of course, but I'm going to tell you that the number one reason that you see unevenness, okay, in the abdomen, it's not fibrosis, it's not uneven lipo, okay, and those of you who've been following for a while, you know what I'm going to say. The number one reason that you see unevenness, especially in the belly area after lipo, is loose skin. Skin laxity. Alright? This goes out to all my patients out there who are like, I say, do your tummy tuck first. And like, no, doc, I don't want to do my tummy tuck. Let's just do this, see what happens. And I'm like, okay, but remember, I told you tummy tuck first, right? And they're like, no, let's just do the lipo BBL. I'm like, alright, we'll do it. And then they end up with unevenness. They're like, doc, what happened? Is this uneven lipo? I'm like, no. Remember how I told you about the skin laxity and that you should do your tummy tuck first? Okay, now it's coming back to you, right? Okay, so now we got to do the tummy tuck second, all right? But the number one reason for rippling, umbilical hooding, unevenness after liposuction is loose skin. And of course that risk goes up the older you are, if you're a smoker in the past, if you had multiple pregnancies, if you had fluctuations in weight. Okay, that was a good last question. We got a lot out of that, so thank you so much. All right, everybody. So I think that will be all for today. We got through a lot of questions, which is really cool. So keep them coming. I'm here on every Wednesday because it's Hump Day with Dr. Alex Earl, and I look forward to seeing all you guys next week. Ciao.